So medication is not always warranted, and it can be a really helpful and important part of a treatment plan for many children with ADHD. And so that is, our, I think all of these decisions around treatment for a child who's diagnosed with ADHD is a very individual and families have to really think about what approach they'd like to use. It is recommended that what is often referred to as behavioral therapy is a foundational approach for ADHD. And behavioral therapy is a pretty generic term in some ways. Within ADHD, there's kind of several more specific types of treatment that behavioral therapy refers to. For younger children, the term in the clinical literature is behavioral parent training, which it doesn't really describe what it is. It's really about partnering with parents to help them understand how to create an environment that helps their child be successful. ADHD has been described as a point of performance disorder, which means that a child may know how to do their homework, or they might know how to copy their homework assignment from the board, but at the point where they're supposed to do that, or they have to do that, they're not able to do it. And that might be because they're distracted by something else, or their attention is on the person beside them. But and that happens at home too, same thing around expectations. So what behavioral parent training really does is it works with parents to utilize positive strategies to encourage seeing more of the behaviors that we want to see, and then also using positive parenting strategies to set clear limits, clear rules, clear expectations, and create structure around a child that helps them be successful. So behavioral parent training is something included in that. And then there's also similar interventions that can be used in the school setting, really adding kind of structure, daily check-ins, feedback for children about how they're doing that can be helpful for optimizing how they show up or allowing them to do their best in the school setting. So that behavioral therapy is foundational. And I guess what I haven't mentioned yet is even for older children, for teens, teaching organizational skills, teaching them how to manage different demands and keep track of different demands and assignments can be a really important intervention, which also falls under that idea of behavioral therapy. And so when I'm working with older youth or children who have ADHD in their families, I also talk a lot about, because ADHD is a chronic condition, our goal is teaching strategies that eventually these kids are going to use for themselves as they get older. They are hopefully developing life skills that help them manage their ADHD through their life. And often medication can be a really important piece of treatment, and it can make a huge difference, especially when a child is having trouble attending or regulating their kind of behavior, activity level, and impairing their ability to be present in classrooms or get along with friends.